We are live.
And live. We are live. We are live. We are live on a Monday. Good morning to you and yours. And happy Monday. Thank you so much for making time. Welcome to it. We call this Clinical Monday right here on Oram Poppin Chat, on Oram Poppin's Facebook page, on YouTube Live, also on Twitter at N_health. My name is Vee Ka Nkosi. Thank you so much for making time this morning to stream the feature. And thank you so much for always following our content on all our social media platforms. And to be part of this particular conversation, don't forget to leave your comments in the comment section below, either questions or comments rather, right here on Facebook and actually anywhere when you're streaming for myself or for Dr. Tammy. And yeah, I mean, we'll just take them through as we have this conversation. And today we are understanding trans. So it's basically, I want to say class in session because it's trans 101. We're really trying to, understand transgender people, who they are, what they are, almost like what makes them tick. But hey, we're just trying to understand them because a lot of us are a little bit misinformed when it comes to transgender individual. And who else to do that rather than Dr. Tammy Nash, who is a medical officer right here at Oram Pop. And she gets to go. I'm even misgendering you, Dr. Nash. I didn't even say good morning. Good morning. Thank you so much for your time. How are you doing?
Fine. And thanks for having me. How are you?
I'm good. I'm assuming, and it's wrong for me to assume, but you are going with the pronouns she and her,
No,
right?
100% correct. Thank you for asking.
All right. Just because we need to be sure. I don't want to mispronounce. Let me just give you a big background of who Dr. Tammy is. She has been working in the HIV field for over 10 years with a specific interest in key populations. And for the past 4 years, she has been focusing on providing gender-affirming healthcare at primary healthcare level. And like I said, Dr. Tammy, nobody else, who can have this conversation with me better than you. We basically trying to understand transgender people or trans, and I don't even think that trans is the right word to use in this context. Maybe let's start there. Are we correct to use the term trans, or we should just say transgender?
No, I mean, I think it can be acceptable to use the word trans.
Mhm.
My preference would be transgender and transgender woman or transgender man or someone who identifies as trans masculine or trans
Yeah.
feminine. Yeah,
Mm.
yeah.
Just to because we need to then distinguish
Cool.
when we talk under the transgender umbrella if we're talking about women or we're talking about men. But in simple terms, what does trans or what does it mean when we say somebody is transgender or a transgender woman or a transgender man? What is the meaning
Yeah, so when all of us are born,
there?
we are assigned on our birth certificate a sex. So for ease of purpose, let's say male or female, and that's based on our anatomy and what the doctors see. I'm not going to go
Yeah.
into sex, but there is a classification there. But for ease of purpose, let's say male and female.
Mhm.
Um, then someone who is transgender, what identifies as transgender, throughout at some point in their life, for a lot of people it
Mhm.
starts very early. They don't feel that they match the sex that they've been assigned. So
Mhm.
they feel that their gender is not the same as their sex assigned at birth. So if you were assigned male at birth, a transgender woman is someone who, through their life, then identifies as female or trans feminine. Yeah.
Mhm. Yeah. All right. That really simplifies it because I think well, for me, in the beginning stages, I was confusing transgender men and transgender women. I always thought that it's transgender women. It really for me didn't go as deep as understanding the sex that needs to be aligned to the gender. So if you was to say if I looked at a transgender man in my head, I'd say is a transgender woman. So I think that was my confusion with all of it because then, like I said, I didn't really root it to their gender and their sex not really
Yeah.
corresponding. How possible then is it, Dr. Nash, to see if an individual is transgender or I don't say I don't know if when I use the word perceived, I would be correct. But then, if they're perceived or to be transgender, can we say it, by just looking at someone?
Yeah, I mean, it's there's nothing wrong with an individual. There's
Yeah.
no sort of disease process in this. We use the term in the community as sort of a very anecdotal term as you are, what's the word I'm looking for? You pass. So, for example, passing would be that in greater society, you feel or people perceive you as the gender you identify as. However, we do find, especially in resource limited settings, once someone goes through puberty and hasn't perhaps started their journey yet, once you're in your middle 20s, those, I guess we could call them masculine features. So when we're looking at the comparison between female and male, it's often around the bone structure. We talk about an Adam's apple, those type of things. Without surgical intervention, your face would remain as it is. So yes, there are some individuals who in greater society as someone who perhaps looks like they're male, but they're dressed as female. So there may be some confusion, especially because, like you're saying, there's a lack of awareness, a lack of knowledge within greater society. So in some cases, it's a difficult question. In some cases, you wouldn't know, and in other cases, you may pause and think, yes, this person looks a bit masculine or looks a bit feminine for perhaps their gender. Yeah.
Got you. I got you. I think in the LGBTQI, just to throw another interesting point there, Doctor, is that when then a male is looked at and they're feminine presenting, then they would be looked or rather, somebody would think that they're gay. If
Yeah.
a female is feminine presenting, they would not necessarily be looked at as lesbian. So I think it gets to differ.
Yeah.
So I think the correct way to approach it would be to ask someone, maybe perhaps who they are, how they identify as, what is their pronouns, what their names are, sort of to get a clear indication of who they are.
Yeah.
But just to dive into the psychological part of it, what happens to someone? Because I'm thinking it could be a struggle, or it is a struggle, from when you are assigned this particular sex at birth and you grow up not aligning or not aligned to your sex. And then you get to discover this in your 20s. Psychologically, it can have a huge impact. But what happens to somebody who then identifies as trans when we look at their psychological well-being?
Yeah, I just want to pick up on something that you'd mentioned in your comments before. And I do find that there is a lot of confusion around sexuality and gender identity. And I do think it's important to make that distinction. Your sexuality is not your gender identity. They're very separate things. So your gender identity is how you yourself express your gender. And that's where we get the terms transgender woman and transgender man. Your sexuality is who you as an individual are able to make physical and emotional connections with. So gay or homosexual would be someone who makes a connection with someone of the same gender. So yeah, so I think it's important to have that distinction. That you can be a feminine or a homosexual man doesn't make you transgender, doesn't make you a woman, unless you identify as that. Okay. So then picking up on the mental health, I mean, there is a term gender dysphoria, and that's the mental, I guess, anguish or in some cases depression, anxiety that you yourself inside do not feel what your body is showing the rest of the world. And in the past, this was seen as a mental health disorder. And thankfully, we've kind of moved away from saying that trans people have a pathology, that there's something wrong, and that it is just how they identify. So gender dysphoria in and of itself can bring a lot of mental health issues, like I said, depression, anxiety, especially if someone goes through puberty. They may identify as female in childhood, and then they go through puberty, and all these changes happen that are undesirable to them, which can create even more anxiety. So that's within an individual person. And then we have interaction within society and what society perceives us and how society treats us. And society would include close friends and family. So a lot of people don't find acceptance within their families, within their communities. It's very hard to come out as transgender, to then get sort of rejected or isolated. I've got a lot of clients who've had to move from their home of origin to other places because they haven't been accepted. And with that, there's obviously a breaking of close relationships, of important support structures, that can leave someone feeling exceptionally isolated and exceptionally lonely, and then also lead to feelings of anxiety, depression. So there's a multitude of sort of mental health, I won't say disorders, but your general mental well-being that can be quite severely affected by, one, your gender dysphoria, and then two, your relationships in society at large. So being trans there's no mental health issue with someone identifying as trans. It's just more, like I said, your own perception and society's perception. Yeah, so it's really important when providing a gender-affirming healthcare service that mental health plays a vital role. And mental health, again, I want to reiterate, it's just mental well-being. It's all of our mental well-being. It's being able to be the best person you can in society, and feel comfortable in who you are. Yeah.
I got you. Thank you so much for elaborating on that point, Dr. Tammy. I want us to then talk about, you touched, mental health then being part of gender affirming healthcare. So
Yeah.
in my case, we cannot give, or we cannot provide the gender affirming healthcare, but leave the mental health element of it behind, because I think it needs to be an inclusive package. Because again, we're dealing with an individual, becoming. So their mental health also, it is quite essential to the making, or rather to the person that they are becoming. I want us to talk about then transitioning. Can someone then battle, and this would not be because they are transgender or they're identifying as trans, with their mental, or an issue between their transitioning and mental health? Maybe someone, has a mental health history, and then maybe it stems from the family, or, maybe the environment, and it does not necessarily have to do with them identifying as trans. Is there such a relationship in that case?
Yeah, I mean, and I think we've seen with COVID that mental health has really come to the forefront of people's lives, and whether COVID happening gave people a moment to pause and actually sort of reassess. But sure, mental health is very important. So you mentioned the word transitioning, and we can get a bit more into that. But I do find that with a lot of my clients, that when they start their journeys, there can be some relieving of that anxiety, relieving of that depression, because they are finally fulfilling what they feel inside. So there is that element that plays into that, and then I think it is important for us to understand that everyone's journey is very unique. There is not sort of a step-by-step process, and if my journey is different to yours, I'm not less of a trans woman or less of a trans man. And there has been, I think, like, again, around just information and knowledge, that in order to be trans, you have to have gone through, say, a medical transition or a surgical transition, and that's really not it at all. Your transitioning journey is your transitioning journey. Whether that includes hormones, whether that includes surgery, is entirely up to you. What we are here to do is, whatever your journey is, to provide as much support as we can. In whatever you need, and if you go on to things like hormones, then to provide a safe way of doing it, a way that we know from global information that we can sort of confidently say this is a safe way to do it. Yeah.
You touched on medical and surgical transitioning, and perhaps to break it down even further for us to sort of like understand, and especially when we talk about hormones, then where do hormones fall in those two, say, I want to say transitioning type, but on those two topics, would hormones be part of the medical transitioning or part of them of the surgical transitioning, and there's maybe a distinction. I know it is. We sort of like see the distinction, but give us your expected advice on the distinction between the two. Yeah.
Sure. I mean, for simplicity's sake, there is two kind of big areas when we talk about going further than just presenting to society, and one is medical transition. And medical transition is the use of hormones. For transgender women, we use estrogen. For transgender men, we use testosterone. And then some individuals choose to use hormones, some don't. And then there's the whole surgical transition. And the two are separate. Surgical transition, unfortunately, in our resource limited setting, is not necessarily a reality for a lot of individuals. That one, there isn't a lot of expertise. There is, but there's not a lot of expertise within our public health system to even perform the surgery, which is obviously important that it's done safely and correctly. So the surgical transition is, I mean, a really good public examples like Caitlyn Jenner. She went through a complete surgical transition, and there are many aspects to surgical transitions. You can have, for example, a full vaginoplasty, or that's a full surgery down there. You can maybe just have other elements. You can maybe choose to have breast augmentation. So there's various aspects that people will be at different points or have different desires through along their transitioning journey. Yeah.
Got you.
Okay.
I think yeah, go ahead.
No, so yeah, just in a nutshell, medical transition is the hormones, and obviously surgical transition is exactly what it says. Yeah.
I got you. Thank you so much for that clarification there. If you just joined us, welcome to it, man. We call this Clinical Monday for Around Talking Chats. My name is Vee Ka Nkosi, and sitting on my guest on my clinical chair, no, on my guest chair today is Dr. Tammy, who provides has been in the field for quite some time, a little bit over 10 years in the HIV field, but when we really look at gender family healthcare services, she has been 4 years focusing on providing that in the primary healthcare level. If you have a question for her about some of the things that we've touched on so far in the conversation, please make sure that you leave your comments in the comment section below and send through those questions. We just have oh, that comment ran away. Looking at it now. Let's look at it. Says that the only way to begin a healthy week, hashtag Clinical Monday. Thank you so much, Andike, for tuning in. And okay, now my screen has just went. Technology, guess it's load shedding, but we'll keep tabs on your comments, keep them coming. And I'm seeing my screen has been popping with love. It's not for me, Dr. Nash. I think they're seeing you, so they're sending you the love. For me, they're seeing me every day. So take care. So send through your questions as well to other social media platforms. Also www.popin.org for the behind the scenes on this specific topic, or other gender affirming healthcare, and many other things that are included as part of it. Let's talk about hormones. We sort of like distinguish between surgical and medical, and hormones being part of the medical side of transitioning. And it's quite interesting. I wanted to ask you that there are people that identify as trans but wouldn't necessarily want to go through the journey of hormonal therapy, and yeah, because in my head, I'm trying to paint a picture of how, like, the sense of that, because I would say you would want to then identify, or you want to align yourself with the person that you are. And in my head, one of the reasons is for me to take hormones. But if I choose not to, is that is how common is that, Dr. Nash?
Yeah, I mean that's a good point. In most cases, people do want to access hormones. Exactly like you're saying, it's part of their journey. It is something that is going to change their outward appearance, and alleviate some of that gender dysphoria. So it's definitely in the majority. I do have a couple of clients who are very happy without hormones. They present to society in a way that they feel comfortable, they feel confident, and for them, it's not necessary to go onto hormones or go through a certain decision.
Hmm.
But it's definitely in the minority. Most individuals, they had the ability, would access hormones. Yeah.
Let's talk about the hormones used. You did touch that one for females is it's estrogen. I hope I'm saying that
Yeah.
correct. And for male, then is testosterone. Then in my head, it's quite clear of the functions. And I think because maybe I've also interacted with a few of our clients who are taking feminizing hormones, and I do have friends who are trans men who are taking testosterone. But in simple terms, what are the roles of these two hormones for both the transgender men and for transgender women?
Yeah, I mean, so let's look at the estrogen for transgender women. So estrogen is required for the feminizing look, that sort of female look. And by taking estrogen, you get things like you get breast development. You may have your body fat gets redistributed, your muscles, because muscle growth is related to testosterone. So if we're not producing as much testosterone, or we're blocking that to achieve the transition, so then your muscles will get smaller, and it's just around that female profile that the hormones are able to do, and exactly the same with testosterone. So it's introducing a male hormone to the body to achieve those masculinizing effects. For example, like a lot of trans men will grow a beard once they're on testosterone, to present outwardly. Yeah. A lot of them actually notice going to gym, they suddenly are able to develop muscles a lot quicker, and that's just purely based on the hormones. Yeah.
Then if I miss a shot, I mean, if I miss my dose, does
Yeah.
it I guess, well, it would slow and then the process of me transitioning on then presenting the way I feel I am. Does it what does it do actually if I miss a dose, or if I take I'm without a month without my hormones? Does it affect my body at all?
It can, depending on the time, exactly like you're saying. So when we look at the female hormone estrogen, there we break up the sort of, I want to call them side effects, but the side effects are in fact desirable. They're the side effects we want from the estrogen to produce that feminizing profile. So we break it up into those effects that if you stop your hormones, for whatever reason, then those effects will go back to how you were before your hormones. And then there's a group of effects that at the time of stopping, that they will remain. So a lot of the effects that will go back to how you were are around perhaps thinning of your facial hair, the softening of the skin, the muscle tone, the redistribution of the fat. Early on we see a lot of changes around mood. So it's not necessarily a physical change, but around mood and emotions. And that tends to settle back down. And then the other thing that is reversible is around sort of your libido, or your sex drive will go back. Those that are irreversible, breast development, once at the point of stopping, whatever breasts you have developed will not go back. Um, things like there is bone density we talk about, and that's how strong your bones are. So if you look at women, sort of elderly women, they've been exposed to estrogen their whole lives, and they can develop brittle bones. So that won't go back. And then the other important thing to mention around estrogen use and perhaps irreversible changes is someone's ability to have children using their own sperm. Once we start that hormone journey, there's no guarantee that when you stop the hormones, should you choose to have or should you wish to have a child using your own sperm, that you'll be able to. So those are kind of the big kind of irreversible changes. And then I mentioned the reversible changes. So, it's not like we're not giving someone a medication to physically keep them well. For example, like ARVs, we know what happens if you miss a dose. So there is some leeway. You're not going to wake up the next morning and have lost the changes that you were hoping that you had developed. But certainly once we go down the road of a couple of months, sure, you're going to notice some change. Yeah.
I wanted to touch on how long is the change, Dr. Nash, but I think, like you said, it would then depend on an individual. So my transitioning journey would not be necessarily similar to yours. Maybe I might develop breasts, say 3 to 6 months, and, it might take longer. So I guess it does depend per individual, in terms of how they respond to the hormone.
Yeah, 100%. That's exactly what we tell our clients every time. So we kind of have an estimate, and that's to also help me clinically, to kind of say. So I normally say to clients by 6 months, is 6 months, at least 4 to 5 months on the highest dose I can give safely. We should definitely be seeing some changes. Someone notice it. And then there's other things like, for example, breast development that you can develop breasts for up to 4 years, being on hormones, and then at 4 years what you have is what you have. And then if you think about, for example, young girls, going through puberty, there's a variety of changes that happen to different degrees, and it's exactly. The other thing to mention with hormones, and I do get asked this a lot, is, for example, someone specifically wants, say, for example, only breasts, or they want that sort of female curvature. And one thing hormones can't do is I can't sort of target an area. The general body change that happens, like you're saying, depending on you and your own time. But it is important, to point that out, that we can't target an area of your body. You're going to experience, in most cases, all of the changes. Yeah.
Interesting. I'm looking at my time, and already, we've went through, and I still have a few questions, but I'll keep them at two, and then I have to let you go. And I think, when we then have a webinar, because I think that is one of the plans, and we invite other individuals who really dive deep into this topic. But for now, I really appreciate your time and really educating us when it comes to understanding transgender. So let's touch about so hormones. Oh,
Yeah.
well, I'm thinking now there are pills, Dr. Nash. So if I take a pill and have side effects, and I think you sort of like unpacked the kinds of levels of or where they add in terms of level of those side effects, uh, because there are pills and their medication, what are some of those few side effects? Maybe, when you take PrEP, for instance, they'll tell you that they are minor to none. It's a little bit of a headache here,
Yeah.
here. But with hormones, what are the side effects? And perhaps maybe if they link into those kind of side effects that I'm talking about.
Yeah, so I mean, there are side effects, and then there are risk factors associated with hormones. Like I said, the side effects are often the desirable effects. There's a couple like mood changes, that people find undesirable but do settle down. And then we get on to what we call the medical risks. So you were not to be on hormones compared to now that you're going on hormones. And we start talking about things like, for example, blood clots. I don't want to scare anyone, so please don't get a fright. I'm talking like
Yeah.
90%. 50%. Otherwise, we wouldn't be having this conversation. We're talking a couple of percent depending on the risk factor. So one is blood clots. The other is all medication, especially oral, can go through your liver, and that can sometimes they don't agree. Then you increase your risk of like diabetes, high blood, heart disease, which is really important. Why we have these programs that people can confidently do it safely. We cannot guarantee that you won't develop something, but we do it in the safest way possible, and that's ongoing clinical monitoring in the form of blood tests, in the form of assessment. It's not like we give you hormones and say goodbye, we'll see you in 6 months. Yeah, so that's kind of it. But I think around the risks, probably, if someone wants to reach out, I'm happy to talk a bit further about them. But yeah, I kind of don't want to scare anyone, because they can sound overwhelming and they probably need a bit of context. Yeah.
I got you. And I think that's all you expect. If you have any questions with regards to hormones, and first maybe, the side effects and the risk profile, please, by all means, do reach out to us at any of our pocket. Dr. Nash is available for you. And I know that you are going around the country to assist as many girls as possible. So we really appreciate you doing that. So she is, guys, really available. My last question, is important to then speak about other conditions or other let's say conditions while we are transitioning, and ARVs is part of them. You look at, the risk profile, you look at HIV with transgender women, and even, look at them transitioning. I want to talk about, being on hormones, or, let's say being on hormones and ARVs. Is there possible drug interaction there? If there is, what does it look like? Is it scary or not scary? Is it, alarming? Take us through that.
Yeah, sure. So, I mean, I think I just would like to point out we don't have, and this is globally, we don't have a lot of, and I use the word cohort, so it's a group of individuals who have been on hormones for a long time, say, for example, who may be HIV positive. We just don't have the clinical data. So I can't sort of say to you, in this study, this is what we found. However, what we do know, because estrogen is also used for other things, not just medical transition and gender affirming healthcare, and so we have information around that, and what we can see, that they don't have a direct impact on each other. So by taking hormones, you're not going to lessen the effect of your ARVs, or by taking ARVs, you're not going to lessen the effect of your hormones. Yeah, so we consider it a relatively safe, hormones are relatively safe in terms of drug interactions. Yeah.
I've got you. Dr. Nash, I really appreciate your time. That's what we had time for. But like I said, I think we'll engage further on a more bigger platform, and invite other people as well, or other partners as well, to really engage us, to engage with us rather on this topic. There is a lot still that I think we still need to cover. But for now, I really appreciate your time. Where are you going to now? Well, not now, but which is the next pop in that you are visiting next? For Annie.
Yeah, I'll be in HPhaleng on Wednesday and Tshwane on Thursday, and then the following week we'll be doing a KZN. I'll be down in KZN. So, I mean, I just kind of wanted to say something to anyone who may be watching. Please, please, please come to the clinics. They are very safe spaces. The staff are sensitized. We're there to help and support you, for a variety of reasons. But historically, people have not been able to access clinics and healthcare because of stigma and discrimination. And just to make people, there are clinics out there where it is safe, and where the people involved are educated and sensitized around gender affirming healthcare, and where you can find your community and your chosen family. So if you're feeling isolated, please pop in. Yeah.
Most definitely. Thank you so much, Dr. National. I think with that said, we really appreciate your time. I will see you in Tshwane on Thursday, because, well, I'm in Tshwane. We'll see you
Perfect.
Thursday, but I'll see you also in Ekurhuleni and other parts of the pop inlet. Thank you so much for your time. That is that. Alrighty, happy Monday.
Happy Monday. Cheers. Bye.
Yes, cheers. That is Dr. Tammy Nash, medical officer right here at Oram Pop in, giving the ladies all that they need to know when it comes to transitioning 101. And she really just touched on some important points. I'm seeing now they're saying great topic, Dr. Nash, and this is on YouTube. Thank you so much for keeping us active and alive on YouTube. We really appreciate you. Mbuso Mdawe comes in and sending us love. Thank you so much, Mbuso. I think Mbuso, they're all the way in Nehlanzeni in Mpumalanga. Yeah, Joshua should be making rounds there just after Etegwini. Yes, we are looking at having another comment coming in. Thank you for always bringing this aspect and knowledgeable guest. This comes in from out on our YouTube channel. Thank you so much for tuning in. We will definitely bring some more because, like I said, we're looking at doing a webinar on gender affirming healthcare, where we will really dive in deep on these topics, especially when we look at hormones and the kind of I won't say risk factor because it's scaring people, but in terms of the impact that they would have on an individual's body. So we are inviting you for that. But be in the lookout on all our social media platforms to see when that is happening. On Twitter, it is at @_health. On YouTube, it is Oram Pop. And follow our TikTok, where I want to say we dance and we do have a little bit of both fun. We can be serious and have fun and check out our events there as well. It is at Oram Pop in, but otherwise Facebook Oram Pop in, and Instagram is at Oram Pop in. Hashtag Clinical Monday. Also www.popin.org. Listen, I'm gonna see you on. Am I seeing you on Friday? No, something is happening on Friday. Let me check my diary. I think I might see you on Friday for yeah, I'm definitely seeing you on Friday for It's a Wrap, where we sit down and get to dissect yet other issues that are faced by the LGBTQI+. There's a lot to talk about for this Friday. And on the 1st of December, we're seeing you with the Ekuleni team. We are out and about something. But hey, for all of that, make sure that you stick around on our YouTube or rather on all our social media platforms. Until then, I'm not going to stop talking and say goodbye. Happy, thank you so much for being technical as always. Really appreciate you and everybody for tuning in. Until Friday, happy streaming. Bye.